Hello, History of Medicine. My name is Justin Morgan, and this is my final project. I chose to highlight the Hawaiian measles epidemic of 1848. Throughout history, measles was considered to be a life event that almost all children went through. There are even references to measles as far back as the 17th century. Before the vaccine, measles affected almost all of the population at some point in their lives. There were millions of cases of measles and an average of 450 deaths due to the disease annually throughout the United States. Throughout history, the causative factor of measles was unknown until a Scottish physician by the name of Francis Home discovered that measles was caused by an infectious agent in 1757. It wasn't until 1974 in Boston, Massachusetts, that John F. Enders and Thomas C. Peebles isolated the virus that caused measles. The current name for measles stems back to the 14th century Arabic word miser, which means the unhappiness of lepers. The presence of a trademark measles rash has been considered a consistent divining factor throughout the history of the disease. Before the discovery of the causative factor of measles, measles was thought to be a natural part of growing up. The discovery of the causative virus has made to a clinical definition. The medical name for measles is rubeola. Many different symptoms have been attributed to the disease. Simple symptoms such as a rash, fever, cough, runny nose, or even what are called Koplik spots, which are white spots within the esophageal tract. More complex symptoms such as diarrhea, vomiting, and conjunctivitis have also been attributed to the disease. Brain swelling is also seen and can lead to further brain trauma, many of this leading to the death of the patient. Measles has been found to be one of the most prevalent diseases affecting only human beings. And with the discovery and proliferated use of vaccines, measles epidemics have almost ceased to exist. Hundreds of patients a year are saved from a potential death. Throughout history, the initial treatment of measles consisted of addressing symptoms. Palliative care was used whenever possible. Before vaccination was available, patients suffering from measles would be given fluids and pain medication as seen as necessary by the physician. With the availability of cheap and effective vaccines, a state of herd immunity can be reached, providing further protection to individuals within the population that might not even be immunized. Measles was originally viewed as a part of growing up, known as an old world disease in the eyes of European explorers to the Western Hemisphere. Improvements in transportation and contact between isolated communities throughout history has led to a rapid exposure to this highly communicable disease. In modern society, the importance of vaccination has been made evident. Now I'd like to highlight the Hawaiian measles epidemic of 1848. King Kamehameha II and Queen Ka'amalu acquired measles while visiting London and died from the disease. When the disease reached Hawaii in 1848, an estimated 10 to 30% of the Hawaiian population died as a result of this. The Hawaiian population was vulnerable to the epidemic because Hawaiian people did not have a natural immunity to measles. Thank you so much for the time, and all my best.